Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about endocrine histology, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A suggestions, some evidence ideas, reflective statement, and some helpful tips to make your portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that needs to be achieved when this submodule is completed. These are relevant to each submodule. For the endocrine histology submodule, the expectations are that the candidate will gain confidence to prepare, process, and stain endocrinology tissue samples. Will gain a clear understanding of the pathological basis of disorders of the endocrine system. Will gain a clear understanding of how these disorders may be investigated histologically. Will be able to microscopically identify normal and abnormal tissue. Will be able to understand the variety and application stains used in the investigation of endocrine histology. The endocrine includes thyroid, parathyroid, pancreas, and adrenal. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. The first learning outcome is for the candidate to discuss how the anatomy and pathophysiology of endocrine systems interact. What is the anatomy and physiology of endocrine tissue? Overall, consider ductless glands, does not apply to pancreas, high vascularity, specific receptors, neuroendocrine link with hypothalamus and pituitary. Consider thyroid and follicles, single layer of squamous follicular cells, colloid, C cells parafollicular, pancreas and exocrine function via acinar cells, endocrine functions via islets of Langerhans, spatial arrangement of exocrine acini, their ducts and interspersed endocrine islets, parathyroid and locus that can vary. Number of glands, cell types present adipocytes, chief and oxyphal cells, adrenal and cortex, medulla, zonation. How does anatomy and pathophysiology of endocrine tissue interact? Consider how structural changes to the endocrine organs affect their functions. Consider thyroid and follicular cells columnar, colloid sparse, lymphocyte infiltration, hyperthyroidism, hypertrophy and hyperplasia of follicular cells and goiter. Changes in nuclear features, papillary architecture, calcified concentric structures in cancer, pancreas and pancreatitis, autodigestion, inflammation, edema, necrosis of parenchyma, compromised integrity of ducts, type 1 diabetes, loss of beta cells, decrease in pancreatic volume, cancer, tumors can block bile ducts, bile. Backup, jaundice, parathyroid and hypercellularity. Reduced fat cells, hypertrophy, hyperplasia, renal and changes in zonation and cell types disrupting hormone production. I have focused only on the thyroid, pancreas, parathyroid and adrenal as those are stated in the aims of this module. The second learning outcome is for the candidate to discuss how pathological processes including inflammation, neoplasia, and infection relate to endocrine tissue. How does inflammation relate to endocrine tissue? Consider acute and chronic inflammation, cellular infiltration, tissue damage, vascular changes, fibrosis. In thyroid consider follicular destruction, in pancreas consider acinar cell injury, necrosis, edema, ductal changes. How does neoplasia relate to endocrine tissue? Consider nuclear features, cellular appearance and differentiation, architectural changes in tissue. How does infection relate to endocrine tissue? Consider bacterial invasion, cell injury, inflammatory response, necrosis, granuloma formation, hemorrhage, caseation, particularly adrenal. The third learning outcome is for the candidate to explain when and why samples of endocrine tissue need to be prepared prior to dissection, as well as how this should be done. How are endocrine samples prepared prior to dissection? Consider orientation, weight, measure, inking, opening, fixation. Consider sample types you might receive in your lab like biopsies, partial glands, or whole organs and the difference how you prepare them. The steps might be specific to each department but consider SOPs, methodology used, or RC-Path guidelines. The fourth learning outcome is for the candidate to explain dissection, tissue selection protocols and block selection rationale for samples of endocrine tissue, as relevant to your laboratory. How is endocrine tissue dissected? What blocks are taken and why? Consider gross examination, description, slicing, weighing, system sampling approach to obtain adequate representation of pathology, process whole tissue if needed, block selection like visible lesions or abnormalities, multiple blocks for larger tumors, assessment of resection margins, inclusion of normal tissue, specific anatomical landmarks like capsule or head-to-body junction. This might be specific to each department and each endocrine organ. Therefore consider SOPs, methodology used and RC-Path guidelines. The fifth learning outcome is for the candidate to describe how normal and abnormal endocrine tissue stained using H&E should appear when viewed with a microscope. Use examples relevant to your practice. Let's focus on the normal features first. How would normal endocrine tissue stained with H&E look like microscopically? Consider thyroid follicles, presence of eosinophilic colloid, types of cells like follicular cells, C cells, activity indicators like amount of colloid and shape of follicles. Consider parathyroid and its composition of endocrine parenchyma, adipose tissue that increases with age, and fibrovascular stroma, capsule, types of cells like chief cell, oxyphil cells. Consider adrenal gland and the zonation, steroid-producing cortex, inner highly vascular medulla, capsule, cells of glomerulosa, fasciculata, and reticularis zone. Consider pancreas and islets of Langerhans for insulin and glucagon production, exocrine acini that secrete pancreatic juice, intercalated and interlobular ducts, types of cells like alpha, beta, or acinar cells. The fifth learning outcome is for the candidate to describe how normal and abnormal endocrine tissue stained using H&E should appear when viewed with a microscope. Use examples relevant to your practice. How would abnormal endocrine tissue stained with H&E look like microscopically? Let's have a look at the abnormal features. Those are specific pathology. Consider thyroid and the changes to the follicles, cellular infiltration, presence of papillae in papillary cancer, presence of lymphoid follicles in Hashimoto's thyroiditis. Consider parathyroid and visible hypercellularity, lack of fat, number of glands involved. Consider pancreas and presence of cells as solid nests or cords, salt and pepper chromatin in neuroendocrine tumors, amyloid deposition in stroma, cells arranged in trabeculae in insulinoma. Consider adrenal gland and presence of Zellbolen pattern in pheochromocytoma, capsular or vascular cell invasion and necrosis in adrenocortical carcinoma, well-circumscribed mass of cells in adrenocortical adenoma. In general, consider the changes in normal architecture and cellular organization, nuclei, cytoplasm, cell borders, mitotic figures, presence of necrosis, or calcification, capsule might be thicker and fibrous, cell density increased, adipose tissue absent or displaced. This is very specific to each organ and pathology. The sixth learning outcome is for the candidate to explain when and why special stains, IHC markers, and other specialist histology techniques might be required to demonstrate abnormalities of endocrine tissue. Identify all the relevant stains and techniques. Why and when would special stains and IHC markers be used to stain endocrine tissue? Consider H&E and ambiguous morphology, for confirmation of neuroendocrine differentiation, classifying tumors, identification site of origin, detection of specific proteins or hormones, evaluating prognosis, predicting treatment response. Special stains like CR for amyloid, PAS for basement membrane, glycogen, neutral mucins, pearls for iron overload, retic for reticular fibers. IHC stains like cytokeratins, CK7, CK14, CK19, neuroendocrine markers like chromogranin, synaptophysin, CD56, PGP9.5, PSAP, prognostic markers like Ki67, subtyping like PAX8, TTF1, thyroglobulin, calcitonin thyroid specific, CA19.9, CA125 pancreas-specific, benign versus malignant markers like CDX2, CEA, HBME1, inhibin, therapy guiding, ALK, BRAF, CRAS. The seventh learning outcome is for the candidate to describe the staining patterns you would expect to be able to view microscopically for each of the IHC, special, and other staining techniques listed above. Use examples relevant to your practice. What staining pattern would you expect to see on previously mentioned staining techniques? Consider normal and disease-related staining pattern, localization patterns like nuclear, cytoplasmic, membranous staining. Intensity of staining like negative, weak or strong, distribution patterns like diffuse, focal, or heterogeneous. The eighth learning outcome is for the candidate to demonstrate how you are involved in any part of the process between tissue preparation and reporting for an endocrine tissue sample. What is your role in the process between tissue preparation and reporting of endocrine samples? Consider pre-dissection steps like inking, slicing, and your involvement, processing schedule used and why, embedding and any special instructions, microtomy and any special instructions, staining, QC, block check, digital scanning, and issuing slides to pathologists. This is very individual and depends on the training and competency of the candidate. The ninth learning outcome is for the candidate to discuss how cellular pathology investigations impacts the management of patients with endocrine disorders. How do histology investigations impact the management of patients with endocrine disorders? Consider benign versus malignant, in situ versus invasive, subtyping, grading, staging, tumor size and margins, lymph node status, lymphovascular invasion, guiding therapy via ALK, BRAF and CRAS, monitoring progression of disease, prognostic value and value of digital pathology to share images, genomic profiling. Indicative content highlights knowledge and understanding requirements that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In this submodule, candidate is expected to have knowledge and understanding relevant to tissue preparation techniques for samples of relevant tissue. Staining theory for basic stains like HNE and advanced stains like IHC, specials, and companion diagnostics that may be utilized for samples of relevant tissue. Quality control for basic and advanced stains that may be utilized for samples of relevant tissue. EQA schemes for staining techniques associated with relevant tissue. Tissue retention requirements related to samples of relevant tissue. The principles of tumor grading and staging with respect to relevant tissue samples. Invasive and non-invasive surgical procedures and their relationship to the collection of relevant tissue samples. Indicative content also highlights skills the candidate is expected to be able to do. The candidate must be able to use microscope. Resources section on the Brightspace contains some very useful information. Submission of evidence on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible questions later on. Candidate also needs to select an additional piece of evidence relevant to this subsection. I will also share with you some ideas of possible evidence later on in this video. Each submodule requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas you could explore for your chosen piece of evidence. And some more ideas for your chosen piece of evidence. Each submodule also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each submodule. How do you demonstrate that you can draw conclusion from what you have learned, reflect on your current practice and how it can change in the future due to gained knowledge? Think about what is your laboratory in context this submodule. What impacts can your actions have on your colleagues, department as a whole and for the patients? You also need to write a personal reflection on your training and why you chose your evidence. This is very personal to your own circumstance. It should demonstrate your ability to be self-aware when analyzing the gaps in knowledge. You can use it as an opportunity to reflect on aspects of your training, application of your gained knowledge and skills, and how you have achieved your goals. Think about what your evidence demonstrates. Why did you choose this specific evidence for this submodule? Also write what your training was like when it comes to this submodule and how your practice changed due to your training. The reflective statements can also be used as a CPD evidence in case you are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies, for each submodule. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiment. If you like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the learning outcomes in mind when you selecting your evidence. Good evidence will tick off several learning outcomes. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning outcomes for this submodule. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those learning outcomes in mind when answering questions and selecting your evidence. Bye for now.